everyone. It's Melissa Sweet here, public health journalist from Croaky. We're at the National Rural Health Conference in Cairns, and we're just about to speak with Dr. Lesley Russell, who's delivered a presentation at the conference this morning. We heard a proposal at the conference for a body to drive better use of evidence in the rural health sector. We heard Mick Reid from the Royal Flying Doctor Service saying that the rural health sector is too fragmented, not collaborative enough, too many silos, and not making the best use of evidence that we have. So Lesley, could you first of all just introduce yourself a bit more for us and tell us your views on Mick's proposal?
Yes, I'm Lesley Russell. I'm an adjunct associate professor at the Menzies Centre for Health Policy, and I have some wide-ranging interests in health, but I'm particularly interested in addressing health disparities. Look, I'm a big supporter of Mick's proposal for all of the reasons that he has outlined earlier. And one of them is something that's very dear to my heart, which is that we do not make the best use of the evidence that we already have. I said in my talk that I think the basement of the Department of Health must be full of reports, evaluations, commissioned studies that people have forgotten about. And that means that there's a lot of data, a lot of wisdom, a lot of learnings about what works, and perhaps more particularly about what doesn't work, that we could be utilising every day to make rural and remote health better and get better bang for the buck.
So assuming we do have a lot of evidence there now that we already know enough to be making a difference, what are some of the drivers to making that happen? What would this new organisation, what are some of the levers it might be able to work with?
Some of it is just simply collating it all together in one place. A lot of the work on primary healthcare in rural remote areas that was done by AFCRI is available on both the AFCRI and the PICRIS websites. But those are not necessarily familiar to people in local communities. Those are really academic websites. So one of the things that an organisation like Mick has proposed could do is pull this data together in language and with mechanisms behind that language that would be applicable to a community health centre, an active Lord Mayor in a country town, perhaps even a school principal who wanted to do something. What could I do that would make a difference? And there might be a website that would give you an answer.
You're making the very important point that improving health is not only the remit or responsibility of healthcare services, but other sectors of the community really can step up and show leadership. Do you have some examples you'd like to share about that? I think you gave us one from the States today.
There are a lot of examples. There are some great examples from Australia, but the one I talked about was a black pastor in a little Mississippi town who wanted to improve the health of his community. Obesity is a terrible problem in the United States, particularly in Mississippi, and he was able to do that by changing the food that was served at the church suppers. Something that was really quite small, but he was able to engage his community, and it worked. There was another example I saw just last week. I was lucky enough during my time in the United States to visit a wonderful Indian health service in Idaho that's run by the Coeur d'Alene Indian tribe. It's become such a great Indian health service that it actually also serves the local non-Indian community, and they have developed an exercise program for men, differently for men and for women, that's based on learning the tribal dances. So they're learning their culture and getting fit at the same time, and it's no surprise that it's been extraordinarily successful.
So the evidence this new organisation could collate and share wouldn't necessarily be aimed only at clinicians or health service managers, but at a whole range of community groups and leaders. Is that what you...
Yes, look, I make a particular point of talking about the difference between health services and healthcare services, and And health is everybody's responsibility. It's the responsibility. It should be a whole of government responsibility or a whole of community responsibility. So it's about schools and businesses and town planners and park rangers all working together for a healthier environment.
NACHO has just sent in a message via the app citing one of their reports saying that investing in community control health sector makes economic sense. You mentioned that as well, that investing in community health actually pays a lot of economic dividends. Can you explain why that is and how that is?
Yes, there's some terrific data, 50 years worth of data actually from the United States about community health centres which deliver care in medically underserved areas, both rural and non-rural. And it's genuine primary health care, well beyond, so social services, food, immunisations, in culturally safe environments. And what we know is that for every dollar that's invested in those healthcare services, they generate $11 in economic benefits to the communities in which they serve, because they need services that they purchase from people within the community, and because they keep people healthier, people are more likely to work and therefore likely to have more money to spend in the community. We haven't done that sort of analysis in Australia, but intuition tells us that there must be some similar sort of result for Aboriginal controlled health services in their communities, that they bring an economic value well beyond the improved healthcare outcomes. Perhaps we should be pushing economists to make that case, because if we're not going to, if the government is going to fail to deliver on the social justice argument, they might deliver on the economic argument.
Now, you mentioned you're a big supporter of the proposal for a new organisation or entity to drive the uptake of evidence to improve rural health. What are you going to do about that, and what can Croaky readers or people watching this do about it to further that proposal, to make it happen?
I think you have to talk about it and talk about it and talk about it. I think you have to put some proposals about how it might actually function, who might drive it, financially, how it might be delivered, and more particularly how it might be sustained long enough to really make a difference on the table. I think you have to gather up a constituency, and I think that you have to talk about it until you're just totally sick of talking about it, and then somebody might be listening.
Thanks very much, Lesley. All of that suggests that we might be reading quite a bit more about it at Croaky in coming weeks and months. Thank you.
Indeed.
We'll sign off now.